What's going on, guys? Dr. Andrew Fix back here with the code, and we're really excited to bring an awesome interview to you guys today. As I typically say, whoever's tuning in to listen to this, I really appreciate your time and you spending it with us, however you're consuming this podcast. But we've got a great interview lined up with June Ashley. She's a licensed psychologist and the clinic director here at LE Mental Health in the Denver Tech Center area of Colorado. And as some of you guys know, I may have mentioned it on this podcast before. I've actually been a client here at LE Mental Health at this particular location with one of their providers. And what we're going to get into today is talking to June about her expertise as mental health relates to chronic pain and how big of an impact the mental side of things makes in the physical pain that we're experiencing in our bodies. So June, with that, if you could do us a favor and more thoroughly introduce yourself. I really appreciate you hopping on here this morning.
Yes, absolutely excited to be here. And I think just other important things to know for me, because it really does influence my interest in chronic pain, is that I grew up in a family where I had a family member with significant experiences of chronic pain related to health conditions that he had growing up through life. So that sparked my interest, and ultimately I became interested in becoming a psychologist when I saw what his psychologist was able to do to help support him as a child and as a teen navigating these different things. So that was part of my experience with, again, early introductions to chronic pain and the impact in life, and that's specifically my brother. And then I served in the military. So certainly in the military, you see a great deal that people can experience through just the repetitive motion of the different fields and professions or career that they have within the military, and then certainly injuries that they can sustain. So my time in the Air Force helping to support people really brought me to even more of a focus in that and driving me toward becoming a psychologist. And I specifically became a counseling psychologist because counseling psychology is very much geared toward really understanding how people adjust to different things, the experiences that they have in life. It's not always going to be specific to a mental health diagnosis. Sometimes it is something like chronic pain or grief or trauma or things that are more about what one experiences.
Yeah. Well, I appreciate you sort of sharing a little bit of light on that and like what kind of got you passionate and motivated to go down this route of a field. And when was it that you served in the military, in the Air Force?
Oh goodness, trying to remember dates. So 2001 to 2007 was definitely an interesting time to have joined the military.
Yeah. And so what would you say, I guess one of the questions that comes to mind before we go too deep down the down the route of talking about chronic pain is like, what was one of the things that you found during your time working in the military of like, what was one of the more common kind of scenarios that you saw where that somebody was dealing with, where you thought they could like have a profound impact of being treated or worked with from like really diving into the mental health side of things?
Yes, especially during the time I was serving, that was quite a complicated time thinking about stigma toward mental health. And I will acknowledge at that point in time when people would encourage me like, well, perhaps you might like to go talk with a base therapist. I told them in very choice words what they could go do with themselves, because there was just such an expectation of performance, always being ready, supporting your unit and the mission, being ready for deployment. And so I think where the strongest need was for people to know that it was okay to seek help. And I can't speak as much from the medical provider perspective, but I think even that would be something where people would push themselves beyond the point of injury, because again, they wanted to support their mission, they wanted to be ready for different things, they wanted to be able to keep flying, like it was perceived as you having done in some way something wrong or something that would be a problem for the greater good and that would get in the way.
Man, that makes sense. And that sort of hits, I did not spend time in the military, but I've spent like my entire life as an athlete. And you hear so much in sports scenarios, particularly in like a football team, for example, of, just suck it up and deal with it. Or, whether it's something physical hurts or whether somebody's not motivated to do something, it's just like, well, go do it anyways. And I think the piece you brought up of like, just coming to the realization that it is okay to seek out assistance in whatever way, shape, or form that is, to me is like a huge, it's a huge growth step, because just asking for help, no matter what that's for, whether it's like help to do something physical and you want someone else's assistance to help you like move a desk or something, or help talking to somebody so that you can navigate some of the challenges you're going through, is not easy to do in and of itself.
No, it's definitely not easy to do.
Yeah.
Yes.
So then when was it that you got involved in the field of psychotherapy?
Right. A lot of that for me came about because of my Air Force experience. I already had a strong interest in psychology and mental health from my brother's experience and from my undergrad in psychology, but I very much intended to be career military. And while I was serving in the military within a personnel capacity, a lot of what I was doing was supporting people with readiness for deployment, supporting their families while they were deployed, doing a lot of casualty assistance types of things. And I found that I really found so much meaning in supporting people through the most tremendously difficult things that they were going through, whether it was injury that ultimately resulted in them leaving the military or experiencing the death or loss of someone in other ways. I think a big part of what came out of that for me too was seeing just the importance of identity and the way that we see our identity and how we can have challenges to that because of something that we've been through. So I made the difficult decision to leave the military and pursue becoming a psychologist and going back to grad school so I could specifically pursue that.
Got it. So then what was it like when you like first got into the field and you pursued grad school, you got done, and then you started actually working, seeing clients? Where were you at the time, and like what was that like? And then what, depending on how you answer that question, what I would love for you to then talk about is what you've seen sort of change over your time in the career and your time moving from place to place and working in different settings, of like what you've seen change specifically in clients or in the media or in the stigma, if you will, of participating in mental health therapy from then until now.
Right. Okay. Well, I'm going to back up to a little bit within my training.
Yeah, that sounds great.
So much of what we do is really as we learn and as we grow on the job training, what we're going through our graduate programs, whether master's or doctoral or both. So I already knew I was interested in health psychology and supporting people from that perspective. But of course, you get your wonderful grounding in being able to do more general kind of approaches to therapy. So I did have some initial experiences in court-ordered treatment related to substance use, domestic violence, and having the unique experience early on of seeing when people are in treatment, not of their choice, but because it's court-ordered. And part of what really came up, even from my early experience with that, was seeing the impact of injury that people had. They were experiencing trauma because of what they had experienced. They were also recovering from physical injuries that they had had, let alone the impact in their life. So that was a place where I began to see early on how important focusing on chronic pain and other experiences of health is really vital still within mental health for us to do. And as my focus went on from there, I was able to be in some specific settings where I was integrated into healthcare. And that included a neurorehabilitation hospital, both inpatient and outpatient programs. And then going into integrated primary care was where I landed for a long time and considered to be my home.
Got it.
To bring that around to stigma, I think being in a place where people are accessing care for chronic pain, for health conditions, is really important for mental health professionals to do, because then we can be a trusted person that the medical provider or healthcare team refers to where we're right there, and we can make that introduction and start welcoming somebody to the idea of working with us. Whereas in an outpatient mental health setting, even including my clinic, like there's just a little bit more of a disconnect. It can be harder to reach people and welcome them to be part of that relationship with us.
Yeah. Because in the one, right, when you're in that facility and you're like sort of part of that care team, it's not like they have to reach very far to like get in touch with you. You're there, you're a resource for them, as opposed to on the outpatient side. Though there may be some marketing or some outreach, people are seeking you out, right? Instead of you being like right there and easily accessible. Not that you're not easily accessible, but people have to jump that hurdle of like they're going to seek out that care. Well, let's back up to that piece about like, whether it was in your experience on like the court ordered side of things where people are receiving treatment, receiving care. And sometimes I don't even like the word treatment. We had a different gentleman on this podcast not too long ago, and we talked about how the difference on like the physical and medical side of things, where we talk about this spectrum of like illness, health, and wellness. And that like the absence of illness does not mean we're functioning at our best, because wellness is beside that. But the way that we often talk about the mental health side of things is that you either have a problem or you don't. And we don't talk about it as if it's a spectrum, and that like
Yes.
people go through different periods and seasons of their life, and they, we don't need to label them necessarily with a condition or a disease or anything like that.
Right.
People are at different places on their mental health journey. So I guess that's one thing. I don't always like saying like therapy, because mental health practice is something that all of us have to work at all the time.
Yes.
But what were some of the major things that you were noticing that people were going through when you had the opportunity to work with them, when that person had gone through significant physical traumas in their
Yes.
life? And maybe what are some of the things that you noticed with that type of an individual compared to maybe someone you're working with who has not gone through significant physical injuries or surgeries or physical traumas of any sort?
Couple of things that come to mind with that would be certainly whatever led to the injury is something that people often would consider to be traumatic or at least very stressful.
Yeah.
So just the reality of that moment in which likely they didn't feel like they had a sense of control over what was happening really is something that stands out for them. And I think that can sometimes contribute to trying to have control in different ways. And I like to shift that word, and I appreciate how you're shifting away from thinking about treatment with mental health to different language with it.
Yeah.
I like to shift away from the word control to the word choice.
Choice.
So I think when somebody is navigating, recovering from an injury or an illness, they don't feel like they have a lot of choices. And so they are trying to seek what those different choices could be through their healthcare team. And then that can too become quite stressful. And I have immense respect for healthcare teams and providers at all different levels. And it's usually very, very brief interactions and almost like a flow chart of, hey, let's try this, let's try this, let's try that. And that more personalized experience is what clients or patients may feel like they're not experiencing.
Yeah.
So that at the same time that they feel like they're adjusting to changes because they didn't have choice in a situation, now they're feeling like they're not having enough choices or enough time to talk about choices. And they're probably navigating things within their family, within their career life, changes that are happening there.
Yeah.
Another part that I would say, especially with chronic pain, is that there's such a focus on let's get things back to how they were before. Sometimes that's possible. Sometimes thinking about wellness, like it even could be a launching place for somebody to get beyond where things were even for them before. And other times it's not possible for that to happen. So I think that's something that's always important for us to focus on. And when a person reaches a point where physical pain can't be seen on imaging, like there's not evidence of it, it's been in a time where somebody's recovered to the point that they will, I think they start to feel like people have moved away and they're not taking as seriously what it is that they're experiencing, even though it is very much real in their body and in their experience of their life.
Yeah.
So those are the main things that really stand out to me.
And I like that word that you use, choice, or like, having a sense of choice of what's happening and what's not. And I think let's go down that route a little bit of like the imaging, like you said, because that's something we see in our office or in our field of physical therapy often, where someone comes in with symptoms. Maybe we use back pain as an example, since it's so common. And, someone has pretty severe lower back pain. They go receive imaging, whether that's before or after they find themselves in our office working with us. And we see one of two or three different scenarios. They go get an MRI of their back, for example, and this is fairly rare, but that MRI could match exactly with what the symptoms are that they're presenting with in the office. And it could provide us with a nice side-by-side comparison of like, well, this is what your imaging says, and this is what we would expect your symptoms to be based on that. And this is what your symptoms actually are, and those two things line up. But that scenario is not actually that common. Very more often, we find the other alternative where they have this clinical presentation. This is what their symptoms are and the things that they're struggling with. They get their MRI, and it really doesn't look that bad. Like it doesn't look like they would be having those symptoms based off of that finding. And those, I think, are the challenging scenarios to navigate, because then the person is wondering, well, then why do I have the symptoms that I have if it doesn't show anything on the imaging? And I think that puts them into a big questioning scenario. And then the other third sort of scenario that I'll bring up, and this is maybe fun's not the word, but this is an interesting one to bring up to clients sometimes, in that sometimes we see people that don't really have symptoms at all, and then they get imaging and it shows stuff.
Right.
And sometimes what that image shows, like, that doesn't dictate what we're actually feeling in our body. There's a lot of people that have bulging discs or torn meniscus or something, and they don't have back pain, they don't have knee pain, because the imaging and the clinical presentation usually don't always line up.
Yes.
So I guess let's take that middle scenario, right?
Mhm.
Where someone has things that look good on an image. They, like, the injury looks like it's healed, or maybe there really was never anything that showed up on that image in the first place, but they have significant symptoms, right? They have back pain that they're dealing with, or they have knee pain that they're dealing with. When you're working with someone in your practice, how do you sort of approach that sort of a scenario, and how do you handle that? What maybe questions or things do you ask in that sort of scenario? Because those are challenging, I think, for us on the physical therapy side, to navigate, because I think in our society, the way a lot of us have learned from being kids to now is, like, that's just the way the medical system goes, is you get an x-ray, then you get an MRI to help you figure out what's going on. And what we know is those things don't always clue us in to exactly what is going on, because they may not show anything,
They
like
may
in
not.
a scenario like this.
Yes, yes. So I think where I start is with really listening, being curious, understanding, always looking for the impact of this pain in someone's life. So that they know that that space is being given, that they're being heard and understood. And I will talk with them about their experience of the healthcare system, or anyone else who may be involved in their care, or let's say, for example, benefits that they may have if they're a veteran, or if there's workers' comp. Like, there's a lot of different systems that can be involved in that. And somebody being able to talk about just the impact of that is pretty important. From there, I would go into what I would consider, from the psychologist perspective, psychoeducation, really talking with individuals about the biopsychosocial model as opposed to the biomechanical model.
But yeah,
So if we're looking at things with imaging and expecting that there has to be physical evidence that can then be addressed, like, that's a little bit more of the biomechanical approach, which I think you're right. We've been raised to believe that that's kind of how that works.
yeah,
And when we look at the biopsychosocial side, part of what I might be looking for is what's then happened in someone's relationships. Is that pain that they're experiencing leading to them really retreating from relationships? So this is the social side. Is it leading to them no longer participating in sports or other activities that would move their body because of this pain that they're experiencing? Has that then also influenced their sleep, their nutrition, all these different things, where it's not going to show like specifically on that MRI, but has been changes globally that happen for their body and for their mind, and how they're perceiving their day-to-day experience and the friction that's in place now.
yeah,
So I really have a lot of curiosity about that and explore that.
Yeah.
With someone to see what their understanding of that is and what feels like it's not being talked about. The next place that I would go to is really talking about the reactivity of our nervous system, and how perhaps there might not be something that's showing up in that imaging, but something that has occurred, or that they are feeling in different ways in their body. And their mind is really trying to help them by being very alert to any fluctuation that might make that worse. So they're so attentive to it that even something that might be kind of a daily discomfort or inconvenience that we could generally be able to set aside, like, that sets off a pain flare.
yeah,
And having awareness about that. From there, I would move into, from my approach, probably a bit more of an acceptance and commitment therapy perspective, where we identify what do they really value, like, how do they want to be in their life, and how can they approach that, even if that pain is along for the ride.
Yeah.
So that single focus on pain being the main thing that they see and they're trying to constantly see around becomes smaller and smaller and smaller in the context of everything else that they know they're able to do and focus on.
Ooh, I like that, right? You're sort of just changing the way that we're viewing it and perceiving it. And I know I've been somebody that has dealt with a similar scenario like this in, an area of my body that I've had what we'll call chronic pain is my Achilles. And there are, I think the longer that I've dealt with this complication, and the more, quite frankly, the more boxes I've checked and things that I've tried on the medical side of things the more I've become accepting of understanding that there is a huge psychosocial piece of this. And it's not just a mechanical musculoskeletal problem, right? There's more to it than just that. And to that end, the more I have started to dabble or get back into some of the things that I previously was unable to do. And even though I still have pain and discomfort while I'm doing those things, it's like it's less significant in my mind because I'm participating physically and socially in something that I was upset that I was missing out on before.
Right.
So even though I'm not like, like you said, I'm not back to or past my previous level as it relates to the Achilles, there are still many other things that I'm doing that make me happy and I enjoy being a part of. So, and that changes my pain experience. Because it's much, I think most medical providers don't love this anyways. I'm sure you would be similar that like we don't love this like pain rating scale. Rate your pain from 0 to 10 because that's just like trying to put something that's very psychologically and socially and physically driven into it's just a 0 to 10 scale. It's like very objective. And pain to me is not something that's very objective. It's very subjective. And a 5 to one person is not the same as a 5 to another person. And though someone might literally feel the exact same amount of pain from one day to the next, they may rate that differently depending on where they are at physically and mentally that day.
Absolutely.
Yeah. So that's interesting to hear you say that. Well, let's sort of take that conversation and go down this route of talking about how when we've had physical traumas, whatever that's from, whether it's from an injury, someone slips and falls, a car accident, whatever that might be, and then how over the course of our life, this concept of like storing pain or storing mental emotions in these trauma sites within our body, and like we store trauma within our body. This conversation actually came up in the office yesterday with a client, and he was saying how this person has hip pain, and he was saying how his massage therapist told him that they feel like he stores a lot of his stress and trauma in his hips, in his pelvis and hip area. So let's maybe start to unpack that a little bit. And I'd love to hear from your perspective of that. I know there's like books and things on this topic, but let's go down that path just a little bit.
Absolutely. And I will be the first to acknowledge that it still feels a bit mysterious to me, and I accept that it's true.
Yeah.
So I think we're really trying to understand more of that mind-body connection in much more finesse than we've ever been able to before. And
I think I'm right there with you too. It still is like, most physical therapists, I would say, come from this like highly science-driven education approach, right? And when something doesn't make sense to us, like logistically and science-wise, we're like, I have a hard time understanding it. But this is an area that I'm becoming way more accepting to because I know for a fact that it's happening. I just don't exactly know how to explain it.
Yes, absolutely. So I think in my mind, it has something to do with the fight, flight, freeze response and really needing to be able to move through what we're experiencing, like having some way to actually physically express the intensity of the experience that we're having. And often if we're thinking about injury, or even if we're thinking about chronic pain that can just suddenly show up, thinking about chronic regional pain syndrome, things like that, it's almost like we're stopped from being able to carry out that sequence of getting that energy out and getting to a place of having more calm and safety. So I think that's something that I very much focus on with people is get your body moving in whatever way feels right for you. As we could look at EMDR and different things I'm not exactly an expert on, I think that's a lot of what they're looking at too, is how can we tie that mind and body together so that somebody can really see that trauma response all the way through, because that's not what we're getting to do in the midst of the trauma. And I believe that's where it can be stored in our body and experienced as chronic pain. Another aspect of that, as I think about even just the regular conversations that I do with people I'm working with about emotions and what they actually are and how that's different from moods and thoughts and behaviors. I don't know, but many of us are taught very well to not be afraid of specific emotions and to really let that be something where we ride the wave of it, try and figure out what piece of wisdom it's trying to give us. And so we keep pushing it away and pushing it away to where even just those routine emotions that we have can become stuck in our nervous system
Yeah.
in some way. So again, trying to encourage people to be comfortable with their emotional experience and not see it as something where it's good or bad. It just is.
Yeah.
It's trying to tell us what's happening. So I will very much encourage for folks to do yoga, to do mindfulness, to do dance, to do whatever it is that resonates with them, that's accessible in that specific moment.
Yeah.
And then oftentimes I will recommend to people I'm working with that they engage in physical therapy. Because I have found it incredibly surprising how often I am working with somebody who has long-standing history of injury and never connected with physical therapy. And I see that as such an important way of understanding one's body, having time to be able to do that, and developing confidence in one's body and what it's able to do.
Yep. Yeah, and I like that you bring that up because, I mean, quite frankly, that's one of the reasons that I'm here and wanting to be here having this conversation with you is I think from our side of the field and in our profession, we're seeing the significant impact that the mental aspect of things have with people, particularly when, you know, they've gone through physical trauma and then they are at the point where, like, from our perspective and all of the different tests and assessments and measures we can do, that person is doing great.
Yeah.
But that doesn't mean they're fully able and back to the things that they want to be able to do. And there might be a huge mental blockage there, like, you know, whether it's fear or anxiety or nervousness of truly getting back to that thing because they're remembering the experience that they had on the injury or whatever that might be. And we sometimes will use the example of like an athlete who has torn their ACL, trying to truly get back to speed and agility game activities. And there's a big mental hurdle there that they have to jump because you're putting yourself right back into the scenario where you did suffer that injury before. So we have that conversation sometimes, but we're not able to necessarily have it to the same level and expertise that someone like yourself is able to do. So yeah, I think we're seeing the same thing the opposite way that you're seeing. So then I guess I was starting to come up with a question that I was going to ask you about, like, one of the things that we definitely notice, and I'm sure that you do too, is when somebody has other psychosocial things that are going on in their life, other stressors, right? In a period in their life where those other stressors are fairly high, right? Whether it's on the family and relationship side, whether it's on the work side, whether they're not sleeping well or whatever that might be, we see that their physical symptoms are worse.
Yes.
Right? When stress, anxiety, and other things are not where they want to be or where that person wants them to be, their physical symptoms are worse. How do you sort of navigate that conversation with a client? One thing that I tend to see the most in this, I don't have any science to back this up, is when I'm working with a client that tends to have like spine related symptoms, neck pain, back pain, we can maybe even loop the pelvis into that, is those are the things in particular that I really notice are impacted the most by that person's stress level or the other things that are going on in their life, more so than an extremity driven thing. And I tend to just rationalize that as central nervous system is very, very strong in our brain and spinal cord, and the spine is obviously right there. So like that makes sense to me, and it typically makes sense to clients too. But I don't have any data to support that. That's just anecdotally what I tend to see in the office.
Yeah, that is really helpful to know that that's more what you see there. What that immediately brings up for me in talking with folks that I'm working with is kind of how they experience their stress physically. And I can acknowledge for myself, like I can be wicked insightful about emotions. And me as an individual, I will experience things physically for a long time before I fully acknowledge and realize that it's an emotional experience I'm having. It's a social situation I'm in that's tough. So over time, I will just feel my back getting tight and my shoulders getting higher and higher and higher. And people who know me well will see that it's almost like I'm bracing all the time. And it's like bracing against the next thing coming at me. And when somebody also has an experience of chronic pain, like literally, it's like inviting that immobility into those areas and feeling stuck in that.
Yeah.
So that would be something where I would talk with folks about how they're experiencing things. And I don't always practice a lot of specifically cognitive behavioral therapy, although I think there's a lot of excellent resources within that. What I do pull from that really regularly is mapping out with individuals the parts of their internal experience, how they interact with the world, being their thoughts, their emotions, and their behaviors, and bringing that all together to where in emotions, I will also branch that off to include feelings in the body. So somebody who may be telling me, I'm just fine, everything is going okay, my back is feeling miserable and it's really interfering with my sleep, everything else is fine. As we break it down and we look at what they're fully experiencing, then we can find that there is a great deal of distress that's just not being experienced as that outside of physically.
Yeah.
And then that gives us somewhere that we can focus where, again, going back to the idea of choice, like it may not fully resolve what they're experiencing with chronic pain. Having more choices with sleep, having more choices with encountering difficult situations, being able to talk about choices to move toward what they really care about doing, even though they're feeling uncomfortable, can then help to ease that experience of pain.
Yeah. Yeah, that makes sense. And I think that, that idea of like thoughts, emotions and feelings and behaviors, that can drive both ways, right?
Mhm.
Like our thoughts and what's going through our head can of course impact what we think and feel, what emotions we're having and or experiencing, and then what our behaviors end up being. But also the other way around, where you mentioned like you'll encourage clients like get their body moving and start doing things, and that can end up changing how you're feeling and what emotions you're experiencing and then what you're thinking. So it can drive from the mind through the body or from the physical body and getting yourself doing things and what behaviors are you doing, and that can drive the other way. And we know that's true from like a mindset perspective. I know I've talked with clients about, if you put yourself in a like closed off, tight, arms crossed kind of position compared to standing up in a powerful stance, that can change like your confidence level that you're feeling.
Yes.
And we'll talk about that with like public speaking things or something. Like, are you putting yourself in a physical position that is leading down the route of the thoughts and the feelings you're wanting to have, or not? So that's one thing we'll talk to clients about sometimes, is like when they are feeling the pain, for example, are they also then putting themselves into physical positions that make them feel closed off, make them feel guarded, or are they continuing to try and as much as they're able still do their normal daily activities, normal exercise or recreational activities, like the things that they want to be able to do? The more you can still do those things, the less that symptom is going to have, like, I guess we'll say, control over you. You have the choice, right, to try and do that.
Absolutely. And that reminds me too, also thinking of, and I had a wonderful supervisor at a VA chronic pain clinic who would talk quite a bit about what she called a flare-up management plan, a FOP. And what I appreciate with that is that it would help people identify, like, in that moment where I feel like I need to guard my body, there's a pain flare up, things don't feel possible. Like, what are the resources that are available to me? And let me have that planned in advance. Because when we're at that point of feeling that discomfort, like just cognitively for all of us, it's hard to remember the choices and the options. So that plan would include, like, definitely I have my medical team I can get in touch with. In reality, might see them maybe once a month, maybe once a quarter, maybe once a year. So they're not always the immediate. And also having a team in the middle there who would be like your mental health therapist, be your physical therapist, massage therapist, like people who can help you in some way, like very appreciatively, to feel different or understand how you're feeling. Another aspect would be to look at family, partner, like other relationships, people who see you regularly, and planning out with them in advance, like what you need and what you really don't need, what wouldn't be helpful when you're in a position like that. They can help to be what you need them to be at that time, and what you can do for yourself.
I like
That's
that.
mindfulness, moving your body. And I've worked with some folks where physically being able to go out and take a walk around the block is not going to be what's possible for them. Pulling out like a coloring book with mandalas or something like that, and being able to be creative and use color and movement, even if in a small way, can very much be enough to help shift that.
I like that. And I like that acronym too, the flare up management plan. It's just, you're sort of like triaging or tiering out the different, like, what are the different resources and things that you have available and accessible to you? Who might that be or what might that be? And that's a great idea. I never even thought of something like that, but I guess it makes sense that, um, if someone's unable physically to do a bigger, more global body movement, like go for a walk or ride a bike or whatever, or go exercise in the gym or something, they can still likely do other things, right?
Yes.
Whether that's with their hands or with their feet. Quite frankly, I'm thinking too, like that could even be, there's a lot of, whether it's kids or adults using things like video games or virtual reality or something, like
Yes.
another way where you can sort of like be active, smaller physically, but very emotionally and very mentally with something,
Yep.
interacting in a game that could change what you're feeling because your mind is doing something else.
Absolutely.
Yeah, I love that idea. Well, what other types of ideas, and we sort of already talked about this a little bit, but when someone is feeling physical symptoms, and let's go maybe back to that, like storing trauma within our body, or
Mhm.
someone is experiencing their stress in their hips or in their shoulders, for example. What are some of the other tips and ideas that you tend to try and give people, strategies that they can use to try and either uncover that or manage that, or like when they are someone that feels like that's the experience that they're having and they just kind of feel stuck of like, well, I've been told this, but I don't know what to do about it.
Mhm. This is where I think we really can engage in ways that we would consider to be like bottom up or top down. So we can go through the mind and we can go through the body, and both of those are wonderful entry points for that. So one of the things that I think about, and personally I want to look at more for myself when somebody is experiencing more of like that chronic hip pain, like pelvic floor pain, things like that, that may be related to trauma experiences,
Yeah.
is looking into trauma-informed yoga, because that is designed to be very safe and helping somebody to connect with their body in a way that's quite supportive. So that would be something I would recommend that I'm not able to do within the context of my role, but I would make recommendations to. And then also really encouraging people to consider whether they want to go through a course of some kind of trauma specific treatment from the mental health perspective,
Yeah.
which could involve processing the trauma, or it could involve really working with a therapist to understand the impact of the trauma, and kind of like I've been speaking about chronic pain, letting it be something that becomes a smaller and smaller focus or hindrance as they're able to keep moving forward with the other things
Yeah.
that they very much value. So there's many different approaches that can be done there. What I am finding quite meaningful and powerful for clients who are open to looking at it this way is that they're engaged in more of a traditional course of therapy with me. Gradually, I'll help them become aware of what's happening with their body as we're talking through trauma experiences or other difficult experiences. So it's not uncommon for me, like with the chair that you're in, if I'm finding that somebody's guarding their body, they're pulling inward or they're kind of pulling back, they seem very, very tense, or they're at the edge of their seat, like almost like they're ready to leave the room, like a panic sensation, then I'll ask them if they're open to me helping them to just relax, and I'll kind of give them some feedback. Notice how you're sitting.
Yeah.
Notice what you're feeling in your body, what's coming up for you. How about if you lean back, let me get that footstool for you. Let's put your feet up. Let's see how that's feeling. So that can be an approach that I take with them pretty often too.
Yeah.
And then I think there's so much promise in self-compassion approaches. So as much as it can seem like a simple approach, really having people kind of put their hands over their heart and really tell themselves kind things, acknowledging the suffering that they're feeling in that moment, but also like paying attention to their heart beating. There's something immediately very soothing about that and reassuring.
Yep.
So I think when we're in the midst of a trauma response or recollection, we're experiencing physical discomfort, chronic pain, pain flare up, it's so hard for us to trust our mind and body. If we can connect with my heart is there, I'm breathing, I can feel this, I can bring it back to center, then that shows us that something is working well. And that's hard to believe in the midst of those other experiences.
Yeah. Man, I like that. Just approach, like you said, top down or bottom up, and how can we use each of those possible techniques or strategies to change that experience that we're dealing with. And the heartbeat thing is very interesting, like kind of recentering yourself, because we know that that is true from like an infant standpoint, right? And my wife and I have a baby that will be arriving shortly, within the next 2 months or so. And we know that that happens with young children.
Mhm.
Like you hold them, you put them on your chest, they can feel that heartbeat and that calming sensation of you or the parent, and then that can help calm them down and change their situation that they may be crying or something. So
And it calms us down.
yeah,
We're
totally.
in the midst of that too.
Yeah, it's sort of the same thing. Like, that's probably one of the reasons why, like, if you are going through a stressful time,
Mhm.
one of the things that often feels good to most of us is to just get and receive a nice hug from somebody, right?
Yes.
And not like a quick pat on the back, but like a real hug that's like firm, and it just helps to calm you down and
Mhm.
change what you're feeling. Um, and I want to sort of go down that route just a little bit of what did you say that brought up this question? Like, if somebody's open to either receiving feedback, or if someone's open to the idea of like noticing how their body is when they're talking about or discussing something that is going on that's stressful or that's challenging for them. Because I think that probably happens to all of us, right?
Yes.
You're talking about something that either you're having a hard time with or that's stressful in your life, and you either start to fidget, or you start to close off, or you
Mhm.
cross your legs a certain way, and you change your body position. What is something that someone who's listening to this can do, aside from hearing us talk about it, like to be aware of that if they're on their own or if they're not in a conversation with someone like yourself? Like, how might somebody be able to pick up on those cues in their
Mhm.
own daily life?
Yes. I think doing a body scan.
Yeah.
It doesn't have to be a formal body scan, but just bringing an awareness into their body. Like, what am I feeling? Like, what's happening with my heart rate? How's my breathing? Feeling anything in my body? Like, being able to do that is important.
Mhm.
Or I don't know how others would describe it, because each of us feel this a little bit differently. Like, I know for me, I will just start feeling antsy.
Yeah.
Or some people will experience feeling irritable, or that they're not able to focus.
Yeah.
And I will personally like find a way to get out for a walk or get some stretching going, just something like that to move through that motion. And then
Yeah.
that will help me to kind of have a better sense of what it is that I'm actually experiencing. That's hard for us to connect with when many times we're sitting at an office chair in front of a screen or otherwise, and we feel like we have to attend to the next thing. So if that's something where it is difficult for people to connect with that when they need to in the moment, like it doesn't become really like obvious for them, then they may want to for a while play around with a couple times a day, like deliberately do a body scan and check in, some deep breathing, step inside, have that almost as like a programmed kind of thing in one schedule, so you can start to be aware of what's happening.
Yeah, I like that. And I like the idea to, if it's challenging, because I think it definitely would be for me challenging for you to like connect and step into that in the moment when you're distracted by all the other things that might be going on, work or family or just life, of like putting it on the calendar and having it be a couple-minute break where like you go through that practice. One of the things that I've been liking, and I think the first time I heard somebody tell me to do a body scan, and we kind of walked through it, right? Starting at the feet and working our way through the body. At first, I thought, well, how am I going to be able to get my brain to just focus on like that body part? But our brain is so powerful. And the more times that I have tried to do that, I feel like the more aware and noticing I can become of those really little things, like little parts of my body. Like if my goal is to feel my big toe on the floor or something like that. And then another thing, like a breathing practice that you mentioned that I've been enjoying recently, is this idea of doing alternate nostril breathing.
Yeah.
Because even more so than, for me at least, even more so than doing like just a deep breathing or a box breathing technique or focusing on inhales and exhales, when I alternate which nostril I'm breathing in, it it occupies my mind more. And I find myself less likely to stray in my mind to my to-do list or to the next appointment that I have, because I'm focusing so closely just on the breathing.
Yes.
And it's really been a cool technique for me.
Yeah, I think that's fantastic. And one thing that I will also say too is I think when people approach mindfulness, like there tends to be a sense of I'm doing it wrong. I thought about I need to get milk on my way home. Like there's can be so much self-criticism about it. And mindfulness, like the intention is not to have your mind be silent and not wander at all. Like it's really just to notice and to bring it back gently center. And that's where breath can be just a fantastic anchor for that in whichever way that we kind of visualize or approach that or practice that.
Yeah, I like that, because I think I used to be one of those people where like I'm trying to quote unquote, be mindful and not have any other thoughts come into my mind. And then they do. And then you wonder like, oh shoot, am I doing it wrong? Like you said, or why can't I just focus on this? And what I've learned too is, like you said, it's about being aware and noticing when that happens, just recenter yourself. And know that it's okay when that happens. It's not that you're doing something wrong. And I think that falls into that self-compassion piece that you mentioned. Like, I think we all have a tendency, and I'm definitely this way, to be harder on ourselves than anyone else is on us, right? Most of us are our own worst critic. And that can sometimes be a hard thing to deal with and to handle.
It can, and that's where I like how you had mentioned earlier about like moving to the point of wellness, and what I would consider to be an aspect of wellness is the reality that on an existential and like practical level, the relationship that we have that is the only consistent relationship in our life from the moment that we're born until the moment we die is the one with ourselves. And societally, culturally, that's the one that oftentimes we're taught to put always at the bottom, never focus on or feel badly about focusing on. So being able to have that connection and that compassion with ourselves is always something to strive toward. That doesn't mean that things are always going to be wonderful and perfect, that we'll be able to control our thoughts during mindfulness, or that we'll never be fazed by things that are happening. And yet having that relationship be so central and so important to us is a pathway toward wellness.
Yeah, man, that's a good way to put it. Well, I guess what I would like to do is, before we like start the process of wrapping up, we sort of started this episode briefly talking about, there sometimes being this stigma around seeking out assistance, talking to someone from a mental health perspective, and how that maybe has, I think, changed a little bit, at least from my perspective, that has changed. And I think I don't always love to talk about things in pre-COVID and post-COVID kind of terms, but I think one thing that I found myself telling people is, from my perspective, I see a big difference in how much more, how much more normalized, or much more even just talked about, the concept of mental health treatment or therapy, or focus on taking care of yourself mentally, is since COVID started.
Yes.
And I think, though there was a lot of challenging things that people went through, I think that's to me, the best thing that happened as a result of that is this has become a more normal piece of our life. Like realizing that we can't just continue to bottle things up and expect that they're just going to go away. And we started to talk about that before, about like, we're dealing with something physically, but we're just not letting that energy out, whether that's through movement or whether that's through speaking with somebody. And at the end of the day, like, we're going to have energy in and we got to have energy out. And if it doesn't come out, we're going to eventually, that's going to manifest some other way. So I guess where I'm rambling and getting to this question is, like, if you were speaking to somebody who is that person who tends to, they feel things, they don't really talk to somebody about it, they just tend to sweep it under the rug, hold it in, or just internalize that and just deal with it. What we know is that often is going to eventually come to a point where the pressure in that bottle is going to pop the cork, right? And eventually that energy is going to want to get out. So like, what would you say to someone in that scenario who might be dealing with something, maybe they're little stressors, but they just keep sort of piling up, as a way to just start to be open to the idea of starting to do something about that?
Yes. Oh, that's such a good question. I know some of it would vary greatly
Totally,
depending on the
100%.
person and the setting.
Yeah,
So
very much.
I usually would start off with, what is it that you'd like to see be different? Even if it doesn't feel like it's possible for that to happen, what would you like to see be different? Is that okay for us to talk about? And perhaps that's something that we can work toward together. I think what I would very much want to talk with people about is, again, along the lines of like naturalizing or normalizing therapy. You talk with your medical provider on at least an annual basis about how things are going for your body. We don't always have people touch base with us about how things are going for our mood, our mind, our relationships. And that's what a mental health therapist can help you to do.
Yeah.
So that I consider it to be almost as important as an annual medical physical, to have like a physical, basically equivalent for checking in on how you're doing. Are you getting to do what helps you to do well, and what's getting in the way, and how can we help with that? The other thing that I emphasize is just choice. So I think some of the stigma, and I could go on, I could do a whole episode because I'm fascinated by it, and I think it's very important to understand. I think one of the things that has come about with the stigma is that mental health for a long time, it wasn't mental health. It was like you were hospitalized, you were institutionalized, like it had to be at a certain level of intensity for it to really be acknowledged. And a lot of times at that point, it was no longer by choice and you were in treatment. So my foundation is always to emphasize choice.
Yeah.
Okay, come and do one appointment. Great, do one 15-minute phone call with me to see if this is even something that you want to do.
Yeah.
Ask me every question that you have about therapy and what it can look like. Or for example, with trauma specifically, like I don't push that it has to be one approach. And really giving choices in that, whether to really go deeply into reprocessing and talking about the details, or focus on what can be helpful now and going forward. So I think emphasizing choice, emphasizing connection. And the last thing I would say is from my perspective with therapy, like we are able to provide a confidential relationship.
Yeah.
Where we are not part of someone's life in other ways. And so I will fully acknowledge, as much as I know my professional boundaries, like when talking with a family member or a close friend and they ask for something along the lines of mental health advice, if they don't kind of follow or take in something that I say, it's very, very difficult for me not to be upset about that.
Yeah.
And I think when we're looking to other people in our life to be the equivalent of mental health therapists, like they are very invested in the choice that they make. And I will always be invested as a psychologist in someone's wellness, so I can't say that I'm completely neutral in that.
Yes.
Yet I am not going to put pressure on them outside of the context of what we're focusing on compared to what they might experience in other parts of their life.
Yeah.
So it's just a way of having another relationship, doesn't replace all the others, but a place where these things can be focused on with some privacy and some confidentiality and some focus.
Yeah. Yeah, I like that. And I think that's probably been, in my experience, one of the pieces that has been, I guess I would say, the most paramount of just kind of having that neutral party to talk to that's not in that like going through that same thing in your life. It's, it's not your spouse, it's not your mother, your father, your child, your friend, who has a totally different context of that scenario. It's just someone else that is neutral in the scenario that you can speak with and you can open up to about whether or not the idea is for them to like give you ideas or anything like that. They may just be there to listen, when that might be hard for the other people in your life to do because they have their own things that they're dealing with too. So
including you.
yeah,
So,
exactly.
yes, definitely.
Yeah. And then one final question before we wrap this up, because I think that was an awesome answer. If somebody is not ready to have that conversation and talk about what is therapy, what could it look like for me, how could this go? What other ideas might you have for somebody who's not ready to take that step, but they want to start the self-exploration journey of like looking inward from a mental health perspective? How else could they maybe get that process rolling?
Other ways that they could do that could be to do something as simple as journaling, just seeing what's coming up for them in like an either very guided journal kind of context or just like free flowing journaling. The other thing that I will always emphasize to folks is to find a way to play or be creative. So I think that's a big thing that is often missing with mental health, and people, I think, need a lot more permission to do, even though they shouldn't have to have that permission to do it.
Yeah.
So I'd encourage, like, find something you enjoy or that you think you would enjoy and do that thing.
Yeah.
And that could be also very much related to movement. So I'd encourage that. I also want to acknowledge and emphasize too that within our communities, religious, spiritual, cultural, oftentimes there are leaders, there are mentors that we can connect with and have these conversations with. So it doesn't have to be a therapist, and I promise I'm not trying to like, don't spend the therapist. And we have other people and resources. I think the thing to look at is what's the question, like what's your degree of comfort in the relationship that you might already have with that person? Is that someone you can start doing some of that exploration with?
Yeah, I love that. And I think that's like a great way to sort of like wrap or conclude this this conversation. I really like where we started to go during the second half of this conversation. And what I want to do is I want you to now share, June, with us, like if anything that we said sort of like sparks some curiosity in one of the minds of one of the people that's tuning in to listen to this. what would be the best way for them to reach out, get in touch, or find you guys?
Yeah, so they can contact me, just do a Google search for Ellie Mental Health in the Denver Tech Center, and they'll be able to get in touch with me in that way. If they're not wanting to connect specifically as a client, because the phone number out there will lead to our client access team on a
Yeah.
national level, I do believe that we have a way of being able to send a message to us, like a secure form that will then get forwarded over to me. They're welcome to contact me in that way.
That sounds great. And you guys who tuned in to listen to this, we'll include those contact links and things in the show notes that you could, if you're interested, reach out, ask questions, have a conversation, and see where this journey might lead for you. But June, I really appreciate you joining me this morning. This was a fun conversation, and I appreciate you being on the code.
Likewise, thank you.
Absolutely. You guys that tuned in to listen to this, really appreciate your time again. And we hope to catch you on another episode of The Code. And you've heard me say this before, if you've listened to other episodes of this podcast, one of the things that helps us get this out to more people, more eyes and ears, is if you would be able to go drop a review on either Apple or Spotify or whatever platform you're using. Those really make a big difference in helping this get in front of other people. So if you've not already done so, we would really appreciate that. And again, my name is Dr. Andrew Fix, and we'll catch you on another episode of The Code.